Hello, my name is Lieutenant Colonel John Ciccarello here at AT Augusta Military Medical Center, and I'm going to spend the next 20 to 30 minutes talking to you about how you can maximize your benefit from your physical therapy experience over the next 6 to 8 weeks as you perform 30 to 45 minutes of exercise on a daily basis to improve your function. I want to make sure that you learn how you can best travel down the pathway that we want to put you on to get care for your musculoskeletal issue. And I want to make sure you understand the time commitment and the effort that's going to be required from you as you balance your work and family life schedule over the next 6 to 8 weeks. Finally, I have 3 or 4 healthy behaviors that I want to emphasize continually throughout this presentation so that you can take advantage of your body's natural healing process and maximize the benefit from rehab. This introductory physical therapy class is for everyone who has participated in physical therapy before or has never done it before in order to maximize your benefit with physical therapy. You should be looking at 5 items in front of you. On the back side of one page is the patient expectations. It's kind of a recap of this class, and it is what we can expect from one another. On the front side is the musculoskeletal care pathway, which I'll cover in detail, along with a functional goal, your readiness for physical therapy, and importantly, additional resources in the form of QR codes at the bottom of that page. So we are here today in order to maximize your benefit from physical therapy. I want to make sure that you understand how to travel down the military health system pathway for your care, for your issue. And I want to make sure that you understand the time and the effort, commitment that's required as you balance work, family, and your life schedule during your physical therapy time. If you do have questions about physical therapy, contact us. So we're going to start with discussing the physical therapy pathway, or the musculoskeletal care pathway here. Ideally, you received from your primary care provider some first-line treatment for your issue. Optimally, this would have been in the form of exercise. If you look at the bottom of your page, the Rehab, Refit, and Return to Duty QR code gives you exercises which you can perform while you are waiting for your physical therapy appointment. There is an app which the Defense Health Agency has developed, which allows you to go to the app, perform some exercises, record your pain levels with those exercises, and progress along. And they come in level 0, level 1, level 2, and level 3. Trying those exercises before you come to physical therapy is a great way to give physical therapists feedback on how those exercises made you feel. So I'd like to cover a couple things that people have told me what they think physical therapy is when it is actually not. So if you had this experience with physical therapy before, perhaps you didn't actually do physical therapy. Physical therapy is not easy. It takes a lot of effort and dedication and commitment. Conversely, it is also not pain and torture. It should not be so excruciatingly painful that you do not want to do your exercises. It never happens overnight, so it's not an overnight transformation. If you received a massage and some stretches at your last bout of physical therapy, I would offer that they probably should have done more than just that. We don't do massages and we don't do stretches only. There's going to be exercise involved. Your primary care provider may have used the words, "We will try it to see if it works." Although I'm not a big fan of the word try, I grew up in the Yoda generation. It is either do or do not. We're going to do physical therapy for the next 6 to 8 weeks, and we're going to assess its effects on your function. Some people are confused about physical therapy being required to get continued care after separation from the military. That is not a fact. And some people also think that for some reason this clinic or the things that happen in this clinic is part of the DoD and VA disability ratings process. We are not. Finally, what I would offer is if you are in pain right now, and most folks are, we never guarantee anyone a pain-free existence. So what is physical therapy? We're doctors of exercise and movement. We deliver prescriptions of that are specialized healthcare, and we prescribe those movements and exercise to our patients. We tend to focus on restoring movement and function and quality of life, and we help people recover from injuries and surgeries. Most importantly, and I think what I like most about physical therapy is that we tend to empower our patients to take care of their issue themselves and become more adept at that over the course of their life. So physical therapy restores function, and I want to use a staircase analogy here. If you can envision function at the top of the staircase, at the bottom of the staircase, before we even start going up the staircase of physical therapy, I want you to consider that we should have very well-developed health and wellness behaviors. What do I mean by that? Well, I mean that you should be sleeping, eating, gently moving throughout the day, and focusing on stress reduction. If we have a solid foundation of these health and wellness behaviors, we can then move up the physical therapy staircase consisting of range of motion first, motor control and coordination next, force production next. Range of motion is simply how far your joints can move. Motor control and coordination are the way your mind and muscles are connected together, and force production is how much load you can put through your joints and your muscles. We have very clearly indicated on the side of this staircase, if you can imagine, that pain is guiding us towards the restoration of function. If you can envision pain in a yellow color, getting smaller as you climb the staircase, guiding our way there, I want you to envision that pain may reduce as we do this, but it is always guiding us. And it's in yellow because I'm going to introduce a concept called the yellow light. A yellow light movement is something that produces pain above your baseline, which quickly returns to baseline after you are done. And we'll talk more about that. And it begins with a customized evaluation by your doctor of physical therapy, where they take a look at the steps that I mentioned earlier, where we start off with range of motion, and then your ability to coordinate that motion and your ability to produce force through your joints. After we've developed that plan, or after we've done the evaluation, we then develop a plan with you that's individualized based on your goals and where you're at right now. And we provide a daily exercise prescription, which we expect you to do. Occasionally, if your time permits and we feel it's required, you'll be asked to come to our clinic for one-on-one sessions with our physical therapy assistants. We may ask you to go to our clinics or other locations nearby. After several weeks of this, it's important that you follow up with your doctor of physical therapy. Even if you've missed other appointments along the way, that follow-up appointment will determine whether or not you have progressed towards your functional goals. And your physical therapist will do another customized evaluation where they look at those same levels of the steps of physical therapy, your range of motion, your ability to produce strength through your joints, and whether or not you're coordinated. If at those follow-ups we've determined that you are progressing towards your goal, then we're going to continue doing physical therapy until you've achieved your goals. Full truth in lending, once somebody's about 80 to 85% of the way towards their goals, we tell them B's get degrees and they can work the rest of the way towards that goal on their own. If you're not progressing towards your goal, then remember, we have the ability to order imaging, refer to other specialties, and get you to someone who can help you get towards that goal. So I'm going to cover very briefly who's on your physical therapy team. Well, the first person is you. You do all the work. Your primary care provider is the one who referred you here. They are definitely on your team and should receive feedback on how physical therapy is going for you. Your doctor of physical therapy is also on your team. They are the person who is going to help you, who is going to develop the plan with you. They're going to prescribe your exercise and helps you decide when you're complete with your functional rehabilitation. The physical therapy assistant is probably the most important person after you see your physical therapist. They are working with you on a daily basis as you come into the clinic. The front desk staff, who I ask that you contact solely for your appointment scheduling and avoid the central appointment line. They help you schedule future visits. And then finally, if you haven't engaged your family, friends, and coworkers in your journey on this, I suggest that you do so. It is a huge opportunity to get other people you care about involved in your care, and honestly, keeps you accountable and makes the journey more enjoyable. A lot of people want to know how long physical therapy takes. There's a lot of answers to this, and it really is dependent on several different things. Probably the most important thing that it depends on is something you have no control over, and that is your age. I am quite a bit older than the average person, and I heal more slowly. That's just how life works. The good news is you can do everything you can to optimize your level of healing with the healthy behaviors I mentioned earlier when we talk about sleep, when we talk about nutrition, when we talk about stress and resilience or meditation. Those different things can impact your healing in a positive or negative manner. The QR codes at the bottom give you additional resources of those, and I'm going to keep mentioning these healthy behaviors because they are probably the number one thing that you can do for yourself to optimize your experience with us. Another important thing that you don't have a lot of control over how long physical therapy takes is what body part or body issue you're having. Different body parts and tissues have different healing times. If you've damaged a ligament, it is going to take a lot longer than a tendon to heal. Joints take quite a few months, so it's really dependent on the biological, physical, and chemistry laws that govern what tissues you've damaged and whether or not you're respecting your body's ability to load and recover from the loading. Some other important topics I want to cover briefly because a lot of patients have questions about this include some imaging basics, some pain neuroscience basics, and then I'm going to hammer again on the healthy behaviors because, as I've said several different times, they are probably the number one thing that helps drive people towards recovery. So, in terms of imaging, we have done study after study. The scientific community has looked at people who are pain-free and people who have pain. And we've MRI'd both sets of these folks. It's not very often that we find a difference in the images. We've done studies on collegiate volleyball players and swimmers and soccer players, and we have just determined that you can have problems on the image which actually don't result in pain. And that's important to acknowledge because a lot of people come to physical therapy with images already done, and they are concerned about the findings on the image. We're concerned about the findings too. We want you to be not fearful of the things that are in there. Most of the time, for people who are in their 20s, late 20s, early 30s, there are wrinkles and gray hair that start to develop on the outside. You look different at 30 than you did at 20 on the outside. Realize on the inside you do too, and MRIs and X-rays are great at picking up on those differences, and realize that even with my gray hair that you can see, it doesn't affect how my hair functions. And the wrinkles that are on my skin, it doesn't affect how my skin functions. It still protects me from infection, and it keeps everything on the inside where it's supposed to be. So realize that while MRIs are a great surgical planning tool, and most folks who will perform interventions on you that penetrate the skin, such as injections and surgeries, they require those things because it guides their treatment. There is nobody in the physical therapy clinic who looks at the image and decides what to do with you. They are going to treat the patient, not the image. We're going to prescribe you exercise, prescribe you loading, and then decide what to do based on your response to that. So realize that we've done those studies over and over. As you age in your 20s, 20% of the people have findings on imaging that aren't the cause of their pain, and that just progresses with each decade as you get older. Next, I'd like to talk a little bit about some pain neuroscience. I think the most important thing I would tell folks about pain is that hurt does not always equal harm. Every person listening to this, at some point in your life, you've had a pinch or you've touched something hot and thought you were damaged and you pulled your hand away or jerked away, and yet there was no damage done to your skin at that time. It felt like there was, but then you waited a couple minutes and it was okay. And everybody's also probably had the experience where you've hurt yourself and you've caused bleeding or you've caused a bruise and you have absolutely no idea when that happened. So the pain system's designed or evolved, depending on how you look at it, to keep us safe. And over time, it's a really good indicator of whether or not we should avoid an activity. But we've got to respect what it's telling us and realize that sometimes it can get it wrong. One of my most favorite stories to relate to this is there's a pretty famous article that appeared in a medical journal in Britain in 1999, and it is a story of a construction worker who jumped off of a construction platform, landed on a nail that was sticking out. The nail went right through his boot, behind his steel-toed shoe. He looked down at the nail and started screaming. His coworkers looked down and also started screaming, and they bundled him up and sent him off to the hospital where he needed fentanyl, a powerful drug, to calm him down. They cut his boot off, and when they cut his boot off, the nail just fell out because it had gone right between his toes. So there was no damage there. He thought there would be damage. His coworkers thought there would be damage, and he had the appropriate response. And that can happen sometimes. So getting back to something that I mentioned earlier is in order to trust our pain system and rely on the information it's getting us, I think it's important to establish that if you feel an increase in your pain, we need to acknowledge that. If that pain after your movement or after your exercise or after your session then returns back to your baseline, it is almost certain that we did not cause damage with that movement, exercise, or session. That is a yellow light response, and that is how most physical therapy will generate the most positive response. Realize that if you've had pain for a long time, it is scary to have that pain jump up and be worried about, but it is very, very safe to have an increase, which then returns to baseline. Something I like to tell my patients is that tissues heal, but the nervous system remembers. And what I mean by that is if you've had pain for years, the actual part of your brain that's responsible for perceiving that area of your body, receiving signals that are processed as pain up here, that can be sensitized to that. And unfortunately, the only way out of that cycle of where you move your knee and you feel pain, we're just going to have to use a yellow light response and move the knee continuously and move it more and more and more. And over time, the tissues become and the nervous system becomes desensitized to that, and the pain becomes less. So I'd like to talk again about the healthy behaviors here. We can't emphasize these enough. The number one healthy behavior for anyone going through physical therapy or rehabilitation is sleep. Sleep is when all repair happens. During sleep, your body produces sex hormones, your body produces human growth hormones, and your body tends to reduce the amount of cortisol in your system. Even 15 minutes more a day can make a difference, and I don't want to harp on how many hours you should be getting a day. I would tell you, regardless of what you're getting, let's add 15 to 20 minutes while you're in rehab. If you're having problems with your sleep and you're not seeing a sleep specialist or a person who is helping you with that, then let us make the referral, let us talk with your PCM and get that wired down, because if you're not sleeping, you're not healing. The next most important thing to think about is gentle movement and raising your or exercising your cardiovascular system. Ideally, about 150 minutes a week. It's what the American College of Sports Medicine recommends. If you're not moving throughout the day and you're trying to do that 20 minutes in the morning and then you're sedentary the rest of the day, you're not giving an opportunity for your tissues to receive blood, and without blood, those injured tissues can't heal. So healing requires blood flow requires movement. If you're using caffeine, nicotine, or alcohol, realize that they all impede healing. And I just want to, for a visual on this, if you think about the blood vessels that are trying to feed your injured tissues, when you ingest caffeine or nicotine, they actually constrict. And that requires additional work to get the same amount of blood to your tissues. If you have a cup of coffee at 7 o'clock, has 100 milligrams of caffeine, that 100 milligrams has a half-life of 7 hours. 50 milligrams of caffeine are still in your system at 2 o'clock. If you then have another cup of caffeine, 50 milligrams at least of caffeine is in your system until 9 o'clock. And now you've disrupted your sleep. People who think that they can drink cups of coffee before bed and report being just fine sleeping, we've done studies on this, and we know they're actually not getting the deep phase of sleep, which is mostly when the repair happens. So I would advocate for minimizing all of those things during your rehabilitation process. We have additional resources available at the QR code for nutrition. Without going into an extensive discussion here, I want everybody to understand that fresh fruits and vegetables, whole grains, lean sources of protein, and plenty of water is what you should be putting in your body to fuel its repair and its recovery during this time. And I found a lot of folks, the number one reason that that's not happening is it's time management and time prioritization. And that's why I say, look, this is going to take 30 to 45 minutes a day. I want you making your lunch as opposed to going to Wendy's during lunch hour. Unless you're getting the salad at Wendy's, in which case maybe not as bad. Finally, I want everybody to picture in their mind what happens to the human body if it was being chased by a lion. Right? So if you're being chased by a lion and you're trying to escape, or you're in a stressful situation, your heart rate goes up, you begin to perspire. The levels of stress hormone, cortisol, they rise in your system, as do adrenaline and epinephrine. Right? Those are all positive responses when you're being chased by a lion or you're under stress or in a dangerous situation. However, if you have a family, or if you have a job, or if you have a boss, or if you have family and friends, or if you have traffic in your life, on any given day, you're experiencing experiences that have the same propensity to give you that same stress response. And your cortisol level will elevate, and your body will think that it's running from a line, and it won't think that it's time to heal. It is probably most critical after sleep. If there was anything that I would advocate people do, it is practice some kind of mindfulness, meditation, or stress control. It can be as simple as deep breathing for 2 to 3 minutes. It can be a physiological sigh, which is just a quick inhale, twice, followed by a long, slow out exhale. That takes about 8 seconds to do. Can be done by anybody. Additional resources at the QR code at the bottom under sleep and stress can help you navigate that. If you're not doing it right now, you're missing an opportunity to help your body heal better. Okay, so I want to talk about a couple frequently asked questions that we get from people sometimes. So, what should you wear? I want you to wear something athletic, okay? And I've got some pictures here that hopefully you can see. And ideally, we're wearing the service uniform PT gear. That's great. Shorts, t-shirt, socks, and athletic shoes. I've seen a lot of people in my clinic, they show up in clogs because they have a shoulder injury. That seems to make sense until we start realizing that, hey, I'm going to want you to put your something over your head and maybe do some lunges, and now you need something better than clogs. Also, it's important to recognize that if we're trying to examine your knee and you're wearing tights or long pants, that makes it a little bit more difficult. So realize that physical therapists, we need to be able to get to the area in question and look at it and examine it. Most folks that are associated with the military health system realize they should show up 5 to 10 minutes early. Realize that we have a big clinic. We see about 225 to 250 people a day. We need you to be there a little bit early. Sometimes the check-in process is a little bit longer. Sometimes there's parking situations. So 5 to 10 minutes early is a good thing to plan on. We want to make sure you maximize your time with us. If you have other problems that aren't on the referral coming to physical therapy, realize that we can absolutely take care of that. Our physical therapists really do want to help you with what you have going on, but realize that if that's what's going on, and you're going to be asking us to take a look at 5 different body parts, the first thing that we're going to ask you is you're going to need 5 different functional goals. Maybe if it's the neck and the shoulder, you could tie that together. But each one of those body parts has to have a functional goal. And then importantly, each one of those body parts, we're going to need 30 to 45 minutes a day. Even if I give you a cut rate discount for 5 body parts and I only do 20 minutes, that's still quite a bit of time every day. So recognize that while we're more than happy to take care of that for you, we need your commitment and effort on the back end. Some people might be confused about some of the printouts or what's in the patient online portal. Realize that when you have your initial appointment with a physical therapist, that is called a SPEC. If you have group appointments, they're abbreviated group, and those can be either in our gym at the clinic or they can be at a Specker Fieldhouse or other locations. And then a PROC is often a one-on-one appointment, either with a PTA or a PT. And then probably the most important one for you to keep track of is an FTR, and that is your follow-up evaluation with your physical therapist, where you go back and, like I said before, as you go around that physical therapy circle, they're going to reevaluate where you're at, maybe change your plan, and determine whether you're progressing towards your functional goal. If your schedule changes, have a humble request. I would really like it if you didn't no-show. I recognize that the medical care you're receiving doesn't cost you anything, and it is very easy to just not show up for appointments because something else came up. I know we're in the DC area and there's a lot of other things going on, but I would ask that you give us a heads up that you're not going to be there. There's a lot of other things we can do with that time. Sometimes we can help people who missed their appointment earlier in the day and we can get them in. Or maybe we can catch up on the notes that we need to write to help take better care of you. So realize if you do miss an appointment for whatever reason, there is very limited opportunity for rescheduling. As I said before, we're a very busy clinic, 250 people a day. We are often booked out about 3 to 4 weeks. If you cancel an appointment today, that was a follow-up appointment. It will be 2 to 3, possibly as late as 4 weeks to reschedule with that physical therapist. And now we're a little bit behind in your plan, and we've lost the opportunity to keep that cycle going, okay? Also realize that my front desk has been instructed not to reschedule one-on-one appointments or group appointments without that physical therapist reevaluating you. So help them out and make sure you follow up with them. Okay, so in the past couple minutes, I've talked a little bit about how to maximize your benefit from physical therapy. We walked down the musculoskeletal pathway of how you can make sure that you're on track for your care and what you should do if you are benefiting from therapy or not. And we've discussed the time and commitment that's required to succeed in physical therapy. And then, most importantly, I kind of highlighted all those healthy behaviors that you should have resources now of how to go to that I've told you several different times that this forms the basis of whether or not physical therapy will be successful for you. So hopefully that sets you up for success, and we're here for any questions or concerns that you might have, and we'll see you in the clinic.